Okay, so let's start with you letting us know about your joint pain, how you got here, what your experience has been.
Okay,
And you're
so
wearing your appliance right now.
yes, I am wearing my appliance now. The reason I came here is because in my joint, my jaw joint was crunching. When I would eat, I would hear this grinding noise. I could not yawn. I could not get my joint to function without it being sore or hurting, causing some extreme pain. I went to a dentist who gave me a upper mouthpiece that seemed to make it worse. There was no relief for it whatsoever. So as a last resort, they were going to send me to a specialist, and I told them that I wasn't going to Katy or Houston. They needed to find somebody in Victoria, and they found you. And so we've tried this. You showed me a book. I read the book. I watched the video. You explained it to me. I agreed to it, and I was to the point I was going to try anything, just short of having my jawbone operated on. So this was my last resort before I went in for some kind of surgery or whatever it is that I needed to do. But it was to the point I had to do something. I could not live like this.
So last week we put in the appliance.
Yes.
Did not adjust it.
No.
And you felt immediate relief as far as I remember.
It was perfect. Right as soon as I closed my mouth last week, I knew that my jaw had shifted or something over in that joint had shifted, and it was an immediate relief.
And then when we put it in, immediate relief, and you took it out and you bit down, then you had
It was not pleasant, yeah.
Not pleasant.
Not
okay,
pleasant.
So it's been a week. Still haven't adjusted anything. I'm
Right.
going to adjust because your tongue is getting in between.
Right. I
Okay,
have to. You have to work. You have to. With mine, I have to really watch my tongue that it's not down on that bite. My speech, I have to slow my speech down and work on to make sure that on a word that I say, my tongue is not in that back part on the right side.
So on the upper appliance that you had, the thing that I explained is it has a ramp on the top that pushes your jaw back.
Right.
And that pushes your joint back up into those nerves that doesn't feel good.
Right. Well, that one night, I was told you that it was so crammed up in there, my bottom was so crammed up in behind the front, I couldn't even get my jaw. I had to pry my mouth apart to get my jaw loose from that appliance. It was so crammed up in there.
Okay, but a week later, you're now able to take it out.
Right.
And you're able to eat without it hurting the joint.
Exactly.
But what you told me when you first came here is that you feel like your teeth have shifted.
Yes, they have.
Okay.
When I take it out, I feel like everything has shifted. When I bite down, it's not like I used to. It's more towards the front instead of shifting back to the back.
Right.
I'm biting towards like I'm supposed to be, and not my back teeth, my jaw shifting backwards.
So
to chew.
the muscle, what's happening is that the muscles have relaxed and they've come forward. So when you bite down, that's the way you are. It hadn't changed the teeth. It's just changed the way that your jaw.
Exactly.
Your upper and lower jaw.
That's exactly right. Right.